Welcome to Sex Ed with DB. I'm your host, DB. Let's get into it. You know what I've been thinking about a lot lately? How much better everything feels when your body is just comfortable. Less friction, less irritation, more confidence to actually be in the moment. That's a big reason I love Uberlube, and why I have for a long, long time. Yes, it makes sex feel amazing. It's silky, long-lasting, and doesn't get sticky, but it also shows up in ways people don't expect. Hot weather? It prevents chafing. Working out? Same thing. Long day in a dress or shorts? I promise you your thighs will thank you if you use Uberlube. And I love that it's part of this idea of lube without labels, because pleasure, comfort, and bodies don't fit into neat categories, and your products don't need to either. It's just a really well-made formula that works for your body, however you use it. If you want more confidence and better feeling everything, go to uberlube.com and use code SEXEDWITHDB for 10% off at checkout.
I'm Amy from the award-winning Shameless Sex podcast, where we explore sex and relationships with curiosity, expertise, and plenty of laughs. Every week, I hang out with leading doctors, therapists, researchers, and sex educators to talk about pleasure, desire, kink, and what actually helps relationships thrive. Speaking of thriving, my online program, Intimacy Rewired, is back this fall. If your relationship feels a little stuck, you keep having the same argument on repeat, or you're craving more connection, more passion, and yes, better sex, this 42-day program is for you. That's right, you can transform your relationship in just 42 days. You'll get practical, research-backed tools to bring your relationship from so-so to solid gold. The reviews from our first cohort all said the same thing. This program changed their relationships for the better. Ready to get rewired? Head to intimacyrewired.com and check out Shameless Sex Podcast's recent episode, number 493, wherever you get your podcasts or at shamelesssex.com.
Let's be honest, your shower has been strictly business. It's time for some actual pleasure in there. Enter the Magic Wand Waterproof. Same iconic, deep, rumbly power, now cordless and fully waterproof, which means shower, tub, pool, cold plunge, all fair game. You've got 4 intensities, 4 patterns, that soft silicone head, and the flexible neck that knows exactly what it's doing. If your shower routine could use something unexpected and delightful, this is it. Find the amazing Magic Wand Waterproof on their Where to Buy page at magicwandoriginal.com/where-to-buy.
Hi, I'm Jamie.
And I'm Rachel.
And we're still in debt.
Because we're still deadbeats.
We're still losers.
We still care more about dancing than making money.
Actually, we've struggled with money because
most people do.
And that's what this podcast is still about.
The first season of Deadheads was going to be a 5-part series.
Then we kept writing.
Now it's 11 parts.
That's a lot more parts. You can still call it season 1 if you want, or even season 2.
But we're calling it season 1 plus interest.
Get it?
Since launching our first 5 episodes, Deadheads has won 3 very important awards.
Can you believe it?
But it is still very much a labor of love.
When we started this journey, we knew we wanted to investigate the architecture of personal finance,
the myths of financial responsibility,
and to uncover the deeper structures that have created an economy that feels unsafe for most people.
We just didn't realize how much work it was going to take.
Yeah. But at long last, we are publishing every single last drop of our initial vision and have brand new episodes to share with you on June 25th, 2026.
That is so soon.
Yeah, it's really soon.
Paid subscribers will be able to listen to the whole thing at once and get access to the bonus episodes, including our back catalog of interviews from 2025.
Deadheads is now produced in association with Signal Company Number 1, the very cool people who are helping us stick to our promises,
like publishing everything on time.
Make sure to subscribe to Deadheads wherever you get your podcasts.
And join our party on Instagram, TikTok, and Substack.
We love you. Bye.
Hello, and welcome back to Sex Ed with DB. I'm DB, your favorite sex educator and pleasure expert, And today we're talking about libido pills and other kinds of medications with recurring guest, the woman I love who birthed me, my mom, Dr. Rebecca Levy-Gantt. Last season, we brought my mom on to talk about menopausal women using testosterone to increase their libido and overall sexual satisfaction. Y'all love that one, so if you missed it, we're going to link it in the show notes if you haven't listened yet. And today, we're talking about other treatments for low libido in women and people with vulvas specifically. And we're going to talk about a libido pill named Addyi. This episode is not sponsored, but it is one of the only libido pills on the market, hence why we're talking about it. And I wanted to make it clear how this pill worked in the brain. So how does it work to increase libido? Addyi works as a daily, non-hormonal pill that targets neurotransmitters in the central nervous system rather than altering blood flow or hormones. It adjusts brain chemistry to recalibrate the balance between excitatory chemicals that trigger sexual desire and inhibitory chemicals that suppress it. So essentially, it increases the good ones and decreases the bad ones to make you sexually excited. And right now, there are more FDA-approved treatments for low libido than ever before, including Addyi. And we talk about this in the Buzz section, so make sure you stay tuned till the end of the episode for that, and make sure you stay tuned for the pleasure practice of the week. But what can these treatments do? And what can they not do? Let's get into it with my mom, Dr. Rebecca Levy-Gantt. Good evening, Mom.
Hi, Dan.
How's it going?
Really good. Very nice. Very hot. Hot in Napa.
Quite hot, yes. Hot all over the place. And speaking of hot, we're talking about libido today, and specifically libido pills. What they are, what they aren't. Libido gummies, why we shouldn't trust those, spoiler alert, and a bunch of other stuff about libido and libido pills. So are you excited to be on today?
You mean, is my libido good? Yes.
Mom, please.
Isn't
I'm just
that
kidding.
excited?
That's cute. All right. As always, Mom, you're a 15 to 20 timer now. I lost count and I won't count again is the thing. You know how it goes. We start with the quick and dirty. It's our rapid fire segment where we get to know our expert, that's you, through bold questions, honest answers, and real pleasure centered insight. And Mom, this is a challenge for smarties like you who are quite verbose. So I'm going to challenge you to answer in one sentence, and then we're going to get into the thick of it later where you're going to be able to basically talk our ears off, as that's why we're here, to listen to you do that, because you have the knowledge. But for the quick and dirty, we want quick answers. So for question number one, what's the number one myth around libido pills, to your knowledge?
I think it's that because there is a pill for men to help them with their erectile dysfunction, then a lot of people think, can it just be the same thing for women? And isn't there just a pill that I can take that will bring back my interest in sex, my desire, my libido, the way it used to be? And give me that pill.
That was pretty succinct. That was pretty good. I'll give it to you. And that's why this episode is called like the myth of the quick fix, right? Because I do think that there's this idea, in America at least, of like, just give me the pill to fix whatever it is that's quote unquote wrong with me. And because there's been so much research that's gone into ED and men's boner pills, I'm sure that is partially why we as women feel like we deserve that, which we're not wrong. We do deserve it.
Except if it doesn't really exist, then people trying to tell you you deserve it and then creating something so that you'll want it creates this false sense of what is out there for you.
Totes my goats. Next question. What is one thing that everyone should ask their medical provider before trying libido pills, if it's something they are going to try?
I think women should want to know that they are treating the right thing, that they get the right diagnosis. And one of the things we are going to talk about, hopefully later, is that there's a very simple, you're looking at quick and dirty, you want something really quick. There's a simple 4-question questionnaire. It's a screener that I use in my office that we're supposed to use in our offices to make sure that we are diagnosing women with the right problem. So the problem is called HSDD, hypoactive sexual desire disorder, i.e. low libido. And there's a lot of things that it is and a lot of things that it isn't. And I think everyone should at least initially go through the screener so that if you come out at the other side and say, yes, I do have this diagnosable condition, therefore, what can you treat me with or what's available to me? But if you don't have that condition, you shouldn't really go down that pathway.
Totally. I feel like the last time you were on, we did talk about those questions. Can you repeat them?
Yes. It's called the HSDD screener. And it is 4 questions and then a 5th really important question. So if someone thinks they walk into their physician's office and say, I think I have a problem with my libido, then they can just whip out this 4-question screener and say, 1, in the past, was your level of sexual desire or interest good and adequate and, fulfilling to you? So the reason for that question is that there are some people who never had interest in sex. They never had a good libido or adequate arousal, desire, interest. So you're not going to solve that by giving somebody some kind of pill or treating them with one of the things that we're going to talk about today. So if you never had desire, that's a different problem. The second question is, so the first one has to be yes. So you did have desire in the past. The second question is, has that level of desire lessened or changed for you? So you used to have good desire. The classic example, someone has a new relationship. They are very interested. They're very high libido. Heavy. Yeah, exactly. And then over time, married for a long time, same relationship for a long time, older, lots of different reasons, but is your desire markedly decreased or changed? Then 3, personal distress. Someone has to be impacted negatively by the change in that desire. So if someone had good desire, now they don't, but they don't give a shit, then that's not really a distressing situation that someone is coming to you to help them fix. So if there's no level of personal distress over it, then you shouldn't be saying, well, how can I fix this for you? Because they're not asking for fixing. So all of those things have to be yes, you had desire, it's changed, it's gotten less, it's distressing to you. And the 4th one is, do you want it to be back where it was? Like sometimes there's some older people who go, oh my goodness, I don't want to have the desire that I used to have when I was young because 1, my hips hurt or whatever.
That's too exhausting.
They say. Exactly. I don't really want that anymore. But yes, if all those 4 questions are yes, and they want it to be back the way it was, or at least improved over what they have now, all those are yes. And then the 5th question is, can you attribute that lack of desire or that change in your desire to one of the following factors? And there is a really long list of factors. And we did talk about this a little bit last time, I remember. Is it a relationship issue? Is there pain? Is there a medical condition that you think is causing this decrease? Is it a medication that you've started taking? There's a lot of side effects from medications. Are you postpartum? There's certainly couples that I've had in my office where someone would come in only 8-10 weeks with a new baby, and the husband is complaining, why is she not interested in me anymore? And she hasn't slept in 8 weeks, right?
Get out of here.
Exactly. So it also, are there other medical conditions or is there recent surgery? And there's probably a few other things that I didn't mention, but if you can attribute that lack of desire, that change in your desire, that distress from lack of desire to one of those things, you really have to go to those things to fix it. So like if it's a relationship issue, maybe you need counseling. If it's a depression issue, maybe you need antidepressants or therapy. If it's pain, you need to treat the pain. You don't want to say, I want better desire so that I can have painful relations when you haven't treated the pain. So again, this is the screener. So 4 yeses, and it has to be no to the last question. So by asking these questions, I have screened out many, many people who thought this was just a lack of desire. Please give me something to help me. But many people come in and say, yes, all those things are true. And it's not, my relationship is great. I love my husband. I don't know why I feel this way. It's distressing to me. Give me a hand.
Ergo, let's talk about libido pills. So, okay, so let's transition now. I just want to know in general, you're retired now, but you were practicing for over 30 years. Have you had many people who had asked about libido pills throughout your career? And if so, had it come up more lately?
I probably have to just like clear one thing up. Like when you talk about treatment for libido, a lot of the things are not in pill form. So it's not as, and women may or may not know that. And yes, lately people talk about it much more because there's a lot of information out there on social media and such like that. So I would definitely say that over my, 30-something year career, I've had the two most common things, the most frequent things that people in my perimenopause and menopause practice, especially in the last, let's say, 5 to 10 years. One was menopause issues, so hormones. They want to know about hormones, they want to take hormones. And the second one is low libido. So yes, very, very common complaint. And I would say if you're going to look statistically about, if you're looking at premenopausal women, so reproductive age women, let's say up until about age 50 or so, it's about 25 to 30% across the board that would say, maybe without a screener, would just come in and say, I have an issue with my libido. I wish it would be better. And in menopausal women, anybody over the age of 51 or someone who doesn't have natural hormones being made anymore, it's over 50%.
Over 50% who
complain.
Wow.
Who feel that their libido is low. And maybe, as I said, they haven't been screened into that diagnosis yet,
Sure.
but who would come into the office and if I say,
Asking
tell me
about
what I
it.
can help you with today, that would be on their list of things for sure.
Right. So there's clearly like a market for this. Like there
100%.
are a lot of women in particular who are like, you know, my hormones are changing. I have vaginal dryness. I'm not in the mood as much. Is there some sort of pill? And as you said, we can talk about the other forms of treatment that are not pills, but mostly I'm interested in pills just because of the craze around them. And so right now I'm wondering if you can clear it up, like what kinds of treatments are there? What kinds of, you know, types of libido pills are there? How do they differ in effect for different people? You know, obviously most of us are familiar with the little blue pill with Viagra. Like, is that the main one that men still use? Like, give us an overview of the pills situation.
Okay, so Viagra, as you know, is not for libido. Viagra is for erectile dysfunction. So there are 4 approved, FDA-approved medications for erectile dysfunction in the United States. They're all pretty much in the same category of medication. The brand names are Viagra, Cialis, what are the other ones? Levitra and Stendra. They all have the same mechanism of action, but basically they are to bring more blood flow to the penis so that the man has an erection and maintains his erection. So that's really not for libido.
Solely physical.
Right. And because if you really look at it, I mean, I don't really want to just whittle it down to the most basic facts, but for men, ability to have penetrative sex is very tied up in their ability to have an erection and maintain it. And what they want is they want to be able to have a thought in their head and get the erection. But if that's not happening, the pill will do it for them. And then once the erection is there, I don't want this to be a whole discussion about male issues, but you know, if the erection is there, then it goes into that cycle of like, now I can perform, etc. But for women, it's not a physical thing, really, not mostly anyway. So any treatment, any kind of pill or cream or gel or injection or anything that women use, they've wanted it not to just bring blood flow to the area, because yes, during arousal, during sexual activity, you get blood flow to the area. You should have clitoral arousal, clitoral stimulation. But when they've tested straight medications like Viagra on women, yes, it caused blood flow to those same similar tissues, and it was uncomfortable. That's not really the way that most women want to treat their low libido issues. They want it to come into their mind. They want to want it. So any medication that has been designed or come to the market for women is really about acting on the brain. So there's a real dichotomy there to begin with. For men, it's a physical thing, and for women, it's more of a mental thing. And I'm not saying that women cannot become aroused and become interested in sex. And we can talk about, there are medications that can do that. But most women that I would see in my office are coming in because they want to take something or do something that makes them want their partner again.
Right.
So
and we
if
talked
you're-
about that in the testosterone episode, because we read the New York Times article and I was lamenting the fact that these women were like, I hate my husband, but now I like him again when they're, being injected with this med spa testosterone.
Exactly.
Yeah. Okay. Tell me about the treatments. Yeah.
So you have to look at a couple of different categories. One is, what is FDA approved for women's libido? And I would say 10 or 15 years ago, the answer was nothing. But now, with much ado and much difficulty with the FDA, there are a few medications, namely 2. So there are 2 medications that are FDA approved for women. One is a pill, and that's the Addyi pill, and that we'll talk about in a minute. The other is an injection, and the brand name is called Vyleesi, and that is a medication that is, I would say, as close as you're going to get to Viagra in terms of not of how it works. It does work on the brain chemistry, but it is an on-demand medication. So if women think, oh, in 45 minutes, my partner is going to be home and this is a perfect night, kids are out, or it's a good time, they can self-inject with this medication, and it works on your neurotransmitters, increases your desire or your libido, and then able to, let's say, have more fulfilling number of and type of sexual encounters because of that medication. We'll talk, if you want to talk specifically about that medication too, I can, but I can definitely say of the 2 approved medications, neither is extremely popular. And we'll talk about why. Mostly has to do with insurance coverage. And they're not covered by insurance mostly. There are ways to get both of them, and we can talk about that in a minute, but right now I'm just talking about kind of categories. So one is FDA-approved medications, and those are those 2 medications. Then you look at off-label medications. There are definitely, there's a big story about you go do a clinical trial, you're testing a medication because you think it's going to do one thing. Even Viagra is this kind of a story. They were using Viagra in the clinical trials for chest pain and high blood pressure. And lo and behold, as they did their trials, the men would come back and go, oh, by the way, a silly side effect that it had, I had an erection. So they're off-label. Viagra is off-label for ED initially. Now it's approved for that. But off-label use for libido, there's a couple of medications for women, and believe it or not, testosterone is one of them, because testosterone is not FDA approved. There is not even a formulation in the United States for testosterone that can be given to women. Many, many women are on testosterone, but it's not the same thing that you can go to the pharmacy, fill your prescription.
They're getting it under the table.
Under the table, or one of the most common ways that women get testosterone actually that is FDA approved for men is that a lot of practitioners are learning how to down prescribe. So let's say a man was supposed to use 10 milligrams of something. For a woman, it would be 1 milligram. So they need 1/10 of that dose. So physicians have now taken courses and learned how to do percentages, and they say, okay, you can go in, I'm writing this prescription for the male dose of testosterone, you have to finagle it. You have to take all the little packets, open them up, put them into a syringe, and then only squeeze out 1/10 of what would have been the male dose. So in all honesty, the doses last a really long time. But the bad thing is, one, there's a lot of things you have to do to get the right dose. How do you know you're getting the exact same amount every time? You don't. How do you know that you're not going to have bad side effects from it because one day you're having too much and one day you didn't squeeze out enough? And also, why should it have to be so hard? Why can't they make the dosing in the amount? Because now there's so many studies out there that say this is how much testosterone you should give to women to create these particular levels of total testosterone in their bloodstream. And those levels are associated in studies, evidence-based, with higher desire, higher libido, and more success. So, they've been to the FDA many, many times with various testosterone regimens, and they've never been approved. However, in South Africa, in the UK, in New Zealand, in Australia, they have approved doses for women. And those are these pared down 1/10 of a dose of a male dosage. The other way that people are getting testosterone in a kind of regulated way, even though we as gynecologists don't love the idea of getting compounded medications, the way that I used to write for it was I had a compounding pharmacy that I very much trusted. I knew how much testosterone I wanted my women patients to be on. I would write for that amount, and that just seems so much better. The problem with compounding, though, is that there's no checks and balances on it like FDA regulated things. It may be, what if you don't really know your compounder? There's so many compounders that are like nationwide that you don't really know the pharmacist. You're just writing this prescription someplace in Pennsylvania and like they're sending it. And don't forget, testosterone is a controlled substance. So they're also looking at your DEA license. You're doing it as something that is considered, it could be abused, it could be dangerous. So now there are all these studies out there, and there are all these courses for physicians and practitioners to be able to know how, not just to prescribe it, but how to follow it. Like you prescribe, and then when do you do a blood level? What should the blood level be? What are the side effects? What kind of consent do you have to get? So many things, but practitioners want that knowledge now. So they are going out there, finding out, and testosterone is probably the one with the best evidence out there of increasing women's libido, because in the studies, they found that women who have higher levels of testosterone also report better satisfaction with their libido or their interest in sex. When we're talking about off-label, there's one other thing that is also off-label. Well, actually two other things. One is there are prescription medications, like I was saying before, that are for one use but seem to have other side effects. And one of those medications is something that is for anxiety. And I think I also mentioned this last time. It's something called buspirone, or Buspar is the brand name. And it's a very old, very inexpensive medication. But if you look at the physiology of why does someone pleasure seek, right? It's the same kind of thing of like, why do people seek out drugs? Or, why? Because it gives them a dopamine boost. So there are many medications that are designed to increase your dopamine. Buspirone is one of them, not directly, but it ends up increasing your dopamine. And I have used it a lot of times off-label in women who wanted to treat their libidos, didn't really want the whole testosterone thing and figuring out the doses and creams and all that stuff, but maybe they also had a little bit of anxiety, and maybe their anxiety might have been related to this and getting older and things like that. So I would prescribe buspirone. Anxiety would get dealt with, and also as a side effect, as they found out in the studies when that was brought to market, anything that increases your dopamine also increases your desire for pleasure seeking, which i.e. higher libido. So
makes sense.
You've got your FDA approved medications, you've got your off-label medications, and then you've got your supplements. And I know we're going to have a whole portion of this about supplements, but most of them, almost all of them, don't have good evidence behind them as far as have they been in randomized, double-blind controlled studies to say women who took this supplement had a better libido. Oh my goodness, they all of a sudden were so much more desirous. And women who didn't take it took a placebo and they didn't have that effect. Well, all the advertisements for the supplements would have you believe that you take this, and exactly what you're saying before, what women are looking for. Take this and 15 minutes later, you are interested and looking for your partner, etc. And I do have a whole list of all the supplements that say they're for libido. And I would say out of like 30 different advertised supplements, I think one or two have a few small studies behind them. And who is that for?
I love the list that you're creating. I love it.
Because, I knew we were going to talk about all this stuff, and there's endless information out there right now. And if I, as a physician and an expert in this stuff, are going out there and finding so much variety in what it's actually trying to tell me or sell me, what chance does your average person have to evaluate that information and say what's really happening?
Wow, she did her homework in a real way, people.
I'm retired now. I have time to do that.
Let's start there because Libido gummies, I think are everywhere. And it is in the same sense, it's the same kind of advertising as the, pill fix, right? Where it's just like, take your daily gummy. It has these ingredients in it that'll increase your libido. But it's interesting because Addyi is a pill, and then the injectable that you named, right? Like those are pill/injectable medications that are different than the gummies. So like, why are they different? Why do the Libido gummies not have science behind them, and why don't they work?
Well, if somebody wanted to run their randomized double-blinded control studies with Libido gummies, they could probably try to do that. But it wouldn't be to their benefit, because you would not find the difference, because I looked at a lot of the ingredients. I mean, I looked up quote unquote Libido gummies, and it's usually a combination of some herbs, supplements, some vitamins, some amino acids, none of which have scientific studies behind them that say we gave them to this many people and we gave a placebo. Because, how do you evaluate research? This is the highest level of research. You don't say, oh, my sister took one and she felt better. There's your research. They must work. Pay $85 now for this, 1 month supply. So they didn't do the work of giving them to half the population and blindedly giving placebo to the other half, and then do a questionnaire to say who had better libido and sexual energy and all that. They're just making these claims. And the reason they make the claims is because there's some anecdotal data, there's some small studies. I can tell you what has a little bit of small studies. There's something that they call online, quote unquote, the Peruvian Viagra. And it's made from maca root, M-A-C-A. And of all the supplements that I looked up online, only this one has a few small studies, some with some data in there that said, I'll quote you, said especially women who are experiencing antidepressant related sexual dysfunction, said that they had higher libido in taking this supplement. However, there's no standardization about how much should they take, how many milligrams. What about maca that's mixed with something else? How do you know whether the other ingredients are safe? There's no purity test. There's no oversight. People who sell supplements and vitamins and all these kind of things, there's nobody really watching what they're actually putting in those capsules. Mm-hmm. So I don't know why somebody would rather, they hear, oh, this is natural ingredients, so they feel like that must be safe, or they worry that I don't want to take something by prescription because that's synthetic and that has a side effect. But on this stuff, you don't even know what the side effects are going to be. So there's like 1 or 2 supplements, like I said, that have some small study, but I wouldn't even call it evidence. And, you also don't know about dangerous side effects or other things that could happen by taking them. So, as much as what's going on with the FDA right now, people are thinking, who's in charge over there? I don't know. But
sure. What does that really mean to be FDA approved anymore?
But FDA approval is very important because there's a lot of standardization. There's a lot of safety that
norms
goes along
to
with
follow.
That. Yes, and not that there was never an FDA approved drug that ended up being dangerous. Obviously, we all know about those stories. But going through all these hoops and studies and proving things for good and for bad, because now we're going to talk about what happened with FDA approval for one of these pills, and at least you can get a feeling that there's some safety in there, because it's not just randomly out there on the internet taking things that you don't know what's in there.
So you've had pleasurable sex. Yay. But then you get a yeast infection. It's painful, itchy, and a sign your vaginal microbiome could use some support. Happy V creates scientifically sound products to support vaginal, gut, and immune health. Their prebiotic and probiotic is formulated with 7 clinically studied probiotic strains at clinically effective dosages, plus a patented prebiotic to help good bacteria thrive. If you want to support your vaginal health from the inside out, head to happyv.com. Use code SEXEDWITHDB for 15% off your first order, or up to 30% when you start a subscription. That's happyv.com. happyv as in vagina.com. Hello, Sex Ed with DB listener. If you love science-based conversations about sex and relationships, then I think the Sex and Psychology podcast will become one of your new favorite shows. Hosted by Dr. Justin Lehmiller, a social psychologist, author, and senior research fellow at the Kinsey Institute, this podcast offers a deep dive into the science of intimacy, desire, and connection. Each week, Justin sits down with leading experts to discuss topics like attraction, love, communication, fantasies, orgasm, pleasure, and so much more. What I love about this show is that it takes cutting-edge research and turns it into practical insights you can actually use in your everyday life. Whether you've ever wondered what your sexual fantasies reveal about you, how to keep the spark alive, how to explore your kinky side, or how to successfully navigate open relationships, there's an episode for you. With more than 500 episodes released to date, there's a huge library of fascinating conversations to explore. Use the link in our episode description to start with one of my favorite episodes, How to Have Amazing Sex, featuring sex therapist Dr. Emily Jamea. Then subscribe to the Sex and Psychology podcast wherever you get your podcasts. We have a segment that we call The Buzz, and we're going to talk about this, this documentary that's about Addyi. The documentary is called The Pink Pill, Sex, Drugs, and Who Has Control. And it's about the libido pill Addyi, which apparently, didn't realize this. Thank you, producer Will, for sharing. It's named after the Grey's Anatomy character, Dr. Addison Montgomery.
I didn't know that either.
Pretty fun. So tell me about the documentary and just a little bit more about Addyi. Does this pill work for people? Is it something that you feel confident is going to help people? Is this kind of the thing that you foresee as being the quote unquote libido pill that can potentially help women's libido?
I think at some point we all thought it was the pill that could potentially help women's libido. So this documentary, it's a documentary that follows the story of Addyi. And it's actually asking a very big overarching question, not so much can we get this pill approved or does it really work? The larger question that it was asking is, who gets to decide whether women's sexual concerns are quote unquote real, if they're medical problems that are worthy of treatment, and if they are, who gets to decide who has access to them? That's the bigger question for this documentary. And I thought that was a really good thing to know about following it through. So it follows the COO and an entrepreneur. Her name is Cindy Eckert. She acquired the rights to Addyi, and she led the campaign to bring it to the market. So the drug was, again, originally studied for something else. It was studied for depression. It did not work for depression. However, women in the study who were taking the medication came back and said, hey, we have an increase in our sexual desire. So a smart person will take that and say, exactly, if they had this, then let's try and bring it to market for the diagnosis of low libido, low sexual desire. And maybe if people take this, they'll be able to increase it and have more successful and satisfying sex life. So they did all the things that the FDA has said that they needed to do, all the clinical trials, all the safety data, everything. They brought it to the FDA multiple times, and multiple times it was rejected for a variety of reasons. One was safety, one was, is there a clinical benefit? So the FDA was asking, how much better does it have to make your sex life for us to say there's a need for this pill out there? So also the outcome is what were they trying to achieve with this medication? The endpoint, the clinical endpoint, was one more sexually satisfying event per month. And in the documentary, there were people that heard that and kind of laughing about it, like, oh, that's not enough to bring it to the market. That's not enough to risk all the things. But they actually had someone on a panel that was talking in this documentary that said, you know, for a woman who hasn't had sex in a few years because she wasn't interested at all, and you could increase that for her, who are they to say that that's not valuable for her, right? So I think the way you have to look at it is, it's certainly not the be-all, end-all that everybody thought it was going to be, but it has a place. And if women have, you know, exhausted their other possibilities, they definitely have this as a diagnosis, they don't want to do testosterone, or they can't find somebody to prescribe it for them, or they don't want to take the risks, or there's a reason they can't take testosterone, this should be a valid choice, you know, if the expense were under control.
Interesting. So really it's like a kind of multifaceted look into the pill. And I also want to name, we'll put this in the show notes, we've had an episode specifically with you on hyposexuality disorder. So that I feel like is relevant kind of pre-listening before coming here. Because exactly like you said, the reason why this episode is titled, right, like the myth of the quick fix, is because you don't need to just only take a pill in order to reignite your libido, right? Like we talk all about what does your masturbation look like? What does your relationship look like to your body? Do you have time? What's your stress look like? Are you engaging in porn or audio erotica or something? Reading a smut passage to get yourself in the mood? What's your relationship with your partner like, right? Like there are so many different pieces to this, and a pill shouldn't be the only thing that you're engaging in. However, as you just said, that's the key, that's the ticket that I really wanted to get to here, which is if you've exhausted all your other options, you should be able to have some sort of medication, especially since, again, like you said, it's different for men versus women. For people with penises, they have Viagra, that's a physical thing. For women, for people with vulvas, it's more mental. I want to be able to get in the mood in order for my body to then react. And if this pill or the injectable that you talked about earlier, or testosterone, right, can help that, and it has studies behind it, that's the most important thing.
Yeah, I also don't want to leave this conversation, though, without also saying that this idea of libido that most people in society seem to have, that especially the way a lot of women look at it, like, I want to look at my partner, I want it to be in my mind, like my desire is rising, like it's coming out of some kind of novel. I think we have to allow women, through education, to wrap their head around the idea that there is such a thing as responsive desire. Like, what about you're lying in bed watching TV, you're not really that interested. You wouldn't have said to your partner, hey, I'm interested, I want to have sex right now. But what if he starts talking to you in a certain way? What if you start watching something that's stimulating to you? What if he gives you that great massage and cooks you dinner and washes the dishes and does all the
triple
things
threat
that makes you start to feel like, oh, I'm starting to feel that. So that could be, you could enter and exit that desire conversation at any point there. Could be something that stimulates you and then you feel it. And that's not lesser than. That's not because that's the way I had to get into it, I don't have good libido. That's responsive. And there is actually one medication that I know I've mentioned the last time also, that let's say if women are thinking of it in a way that they want it to be in a certain order of things, they want it to be in their mind first and then feel the blood flow to the genital area. What if it was backwards? What if you took something topical like that had estrogen and testosterone and Viagra in it, and maybe some medication that acts as a vasodilator? There is a compounded medication that acts that way that is completely not FDA approved, but I have had the occasion to prescribe that for some patients and explain it to them that, again, maybe you're thinking, I would like to want to have it tonight, even though I don't feel it. But you put that medication on around the clitoral area at the vaginal opening, and you feel this rush of blood or you feel warmth. And then your mind says, oh, that was the feeling I used to feel when I had desire. And that's not lesser than either. That is another way. And, if you've got a partner that you want to be with, all of these ways of better desire or better sex should be available to them.
100%. Yeah. Mom, you're just a wealth of knowledge. I love having you on. It has been so much fun. Thank you for always being willing to just be the best and share information and education with such honesty and transparency. And that's what I try to do because of you. So thank you for being on.
Thank you. I love being on your show.
I love you. Welcome to The Afterglow, where we wind things down, reflect on big takeaways, and leave you with one juicy thing to try, think about, or explore before next week. Thank you so much to my beautiful, brilliant mom for this incredible conversation. She really did her homework, and we love her for it. She is a goddess in that way. She's very prepared. She comes with a lot of notes, guys. I gotta cut her off all the time. But she's incredible. She's so smart and just knows her shit, Mom, I know you're listening to this. I love you. For me, this episode had a lot of takeaways, but the biggest takeaway from this conversation is remembering that there is no miracle pill out there to fix anything, let alone low libido. There are things that can help, but it all depends on that root cause. There is still so much that we don't know because, of course, women's health and pleasure never get the priority in research that they deserve. And please remember that just because something is quote unquote natural does not automatically mean that it's better for you than an actual prescription medication. Supplements, like my mom said, are not regulated. And not only does that mean that you might not know what ingredients you're actually getting, but it also means that the side effects haven't been tested like they have for medications. If this conversation resonated with you, think back to my mom's 4-question screener. Then maybe bring it up to your medical care team. We'll put the questions in the show notes along with our episode about women using testosterone. And now, the moment you've all been waiting for, your pleasure practice of the week. Say that 5 times fast. What gets your libido really going? Is it someone hitting a turn on of yours or feeling really healthy physically and mentally? Or even, is it during your ovulation? Is your libido a little slower to wake up and need some encouragement? Try pinpointing exactly what gets you going, not just mentally, but physically. And then try tapping into that energy. Figure out if it is lighting a candle, or looking at porn, or listening to porn, or thinking back to your college crush, whatever, or celebrity, for God's sakes, the world is your oyster. If you can, and if you want, try to find a new way to encourage that energy more in your day-to-day life. I just feel like we need to be turned up more. You know what I mean? And your pleasure practice of the week is to think about that and to keep note of it in your mind or in a journal. Just write it down, think about it, and let that influence you in your everyday life. Thank you so much for listening. Thank you to my mom. I love you. You're the best. And I love you all. Talk to you next week.